Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. I have a great guest in the building with me today, someone that I've known for a little bit. We've been in some rooms together for a couple times, but finally been able to connect a couple months ago and just learn more about the work that she is doing. I have Miss Jazzmine Brooks in the building with me today. Jazzmine, thank you so much for being with me. I appreciate you.
Thank you. Thank you for having me. Just appreciate the opportunity.
Yes. So, before we get into the conversation, can you tell the people a little bit more about yourself and what gets you up in the morning?
Oh, I love that question. So, Jazzmine Brooks, she, they, my work is centered around full spectrum doula work. I'm here to agitate us towards health equity. And part of that reality is supporting families through their perinatal journey, whether they are doing reproductive or fertility work, to having a baby, to lactating, those types of things. I'm also a third year doctoral student at Iowa State University. My research is in human development and family studies, and I will be focused on centering our narratives around birth work and midwives, Black midwives specifically, reclamation of their traditional practice. What gets me up in the morning, I really practice a lot of gratitude before I go to bed, and I do a lot of gratitude in the morning, just because it's life is life, and
Yeah.
I do a lot of people work, right? So it's just a lot of energy transference. Folks really feel comfortable sharing their stories with me, and so I really just feel like I'm doing purposeful work and just express gratitude for being a spirit on this earth that, folks could connect with and feel supported by, and just want to continue to be able to do that as well as take care of myself, right? Because I can't be giving
Right.
and not filling my cup back up. So just gratitude.
Yeah. Life be lifing, and gratitude is is amazing. I love what you said, and I want to get more into your doula work and everything you do, but you said something about agitating health equity. I just love that, or agitating towards health equity. I want to make sure I say it correctly. I love that so much. I would love for you to kind of like go a little bit further with that. When you say agitating, what is that? What is health equity in doing that work? What does that mean to you?
Yeah, I think about it in a couple of ways, right? I start with my privilege. I am a cisgendered woman who is married to a cisgendered male. I'm middle class. And I also think about like my other identities. So my family's from Belize. I am born and raised in a very urban area. And so all those things kind of help to have me navigate my lens in spaces. I can understand folks seeing my voice as something important because I'm a doctoral student. And so I speak the language of academia. I use those types of inferences where, folks in certain spaces wouldn't allow, folks in the community to come into. And so I feel like my seat at the table is to stir things up, is to educate, hold people accountable, model, and realize
Mhm.
too that if I'm in a space, that doesn't mean I need to sit there forever. I think that's part of the work that I'm still working through, is like that seat doesn't belong to me, right? If I got in the room, pulled up the table, what are we doing? And if I have to create a table, right, the
Mhm.
creation of it isn't me saying, well, I'm trying to be a savior for my community. I don't want to operate out of that. I want the community to be able to do the work that we've been doing for generations, right? Beyond just our experience around chattel slavery. Like, I want us to do that. When it comes to health equity, I really think about how are we creating, building bridges to create more access. There's a lot of folks left behind. I think COVID has given us a big mirror of how does this work and how it's not working for a lot of people. When we bring up, Black maternal and infant mortality, it's not working for certain communities. And so my big piece is accountability, and it's going to be uncomfortable. I'm going to say things that, stir the pot, but it needs to be said. We can't sugarcoat it anymore. We can't
Right.
make it comfortable for people. Like, people are dying, right? Like, at this point, this is life and death. We can't make it look pretty with a bow on it anymore.
Right.
Mhm.
I feel like any conversation when the goal is progress, is it has to be uncomfortable. There has to be a little bit of uncomfort there, and that's just the name of the game. If there isn't any, you're not really making progress, especially around some of the work you're doing, and you're making, with the doula work and being more equitable for people of color or anyone who wants a doula to be able to have access to that. Can you tell me a little bit more about, what, what was your interest? What got you interested in becoming a doula, and what inspired you to keep on with that path? Not only doing the work, but spreading the message of the importance of having a doula.
Yeah, so I mean, I take that question back to grade school. I wanted to be an OB. I was terrible at math and didn't receive a lot of support in my dreams of going to medical school. I ended up going to school for journalism, but it still worked out, right? Obviously. But that was I loved watching Baby Story. I don't know if you remember that show back
No, baby
on
story.
TLC. Oh my god, Baby Story was like my favorite show to watch. These Watching these families, on their journey towards in their pregnancy to have giving birth. I just loved everything about all of it. I didn't want my own kids at the time, but I was like, "Oh my god, I love this." So when we moved to Iowa back in 2016, I got married, and of course, you hit a certain age and folks talk, oh, you're married, so let's start talking about children. And we weren't really there yet, but I was like, this is interesting conversation. I'm like, guess I'm maternal age.
Mm,
And I realized very quickly as a Black woman navigating health in general in Iowa, as I was a healthcare desert, that I really didn't have a ton of options. And so, knowing me, wanting to research and learn more, I started to see so many issues around Black maternal health and what that all is wrapped up in. And I was like, okay, what are my next things? I was doing violence prevention work at Iowa State, already knee deep in reproductive justice. And so I was going to go to nursing school at DMAC, like literally went to orientation
mm.
and was like, this is not it. Right. I was looking at people, I'm like, this can't be it. This can't be the only route. Like, this don't feel right. And I found the National Black Doula Association. Don't ask me how, but Tracy popped up on my newsfeed, Tracy Collins, and I fell in love with all her lives and how real and raw and just direct she was about who we are as Black people, as Black agents for change, right? Like,
Mm.
she was really about it. And I was like, man, you down in Atlanta, how am I going to get down there? I was like at a crossroads with my own mental health at the time. So I tell people the story of like I cut all my hair off because I was natural for like a few years and it was just not working. Cut all my hair off, went down to Atlanta for a weekend. I told my partner, I said, I need to become a doula. And he was like, all right. I was like, I'm glad he didn't say anything other than, all right, how we going. And every night after training, I sat at a Waffle House and I just cried because what
Mm,
I didn't realize was how undone I was becoming as like a Black person. The unlearning I was experiencing just over that weekend, she was doing so much mending of me as a human, as a Black person, that I was not ready for. And it took me a couple of months before I said to the world, I'm a doula, because I got my training in September. I didn't start taking clients till that January. And I was like, no one's going to hire me. I'm a new doula. I'm a Black woman. Like, who's going to hire me? And then COVID hit. But I was able to attend all my births, thankfully. It was touch and go for that time being, but all of them were beautiful. I found my first client at a barber shop. such a Black thing, right? And it's been magical since then. And I think about all the hard births I've experienced with families, all the butter births, the ones that are easy, baby just slips out, right?
Hmm.
And all the in betweens. And what keeps me going is one of the births that I share often. Mom was, on her hands and knees. That's commonly what we hope people push in. It creates more room in the pelvis. And so she couldn't really see anything. So baby's coming out, and baby comes out and baby's not breathing. And there was just this intuition in my mind to tell her to call
Mm.
her baby's name. So I looked at her and I was like, call your baby's name. And she looked at me like I was crazy. And the nurses and all them are trying to revive baby, shake her a little bit, rub her back, those types of things to get her to cough up. Baby's just limp. And I was like,
Oh,
name. And she calls her. I said, I need you to say it louder. And she screamed her baby's name, and that baby's life she just woke up. It was
ooh,
like
Jasmine.
powerful thing I've ever experienced in my life. And I'm like, that's what we do, right? Like,
Mm,
we don't want to get to that place because that's not a place you want to be. But like
right,
what we do as doulas, and I'm like, that's what gets me to keep going and keep thinking about how do we spread more education? How do I do more learning? How do we, increase the doulas in our communities, right? Like, how do I share, like you said, this message of the work, and between the bonds with the families, I mean, I become auntie. Like, it's just a powerful experience. And I wouldn't trade it for the world. And knowing that I can help and support life coming into this world in such a very unique way.
right. Wow, that's a powerful story. Thank you for sharing that.
Yeah.
Walk me through that process, Jasmine, of you empowering the women from, their pregnancy to labor to postpartum. Walk me through that. What for those that people who may not even have heard of a doula until they've heard your voice on this podcast, what does that look like?
Yeah. So, I'm going to speak from a research lens. The earlier we see you, the better, right? When you really think
Mhm.
about intervention and preparing the body, like, we want to see you early. And the disparities, particularly amongst the Black community, or, communities of color, we often are not going to the doctor early enough to really get those options. And so with a doula, we commonly hope to see you around your 20-week mark. I mean, I get a lot of clients that are sitting at 8 weeks sometimes.
Mm.
But we really talk through, big thing is doula work in general. They ask me, what exactly can you do for me? And I say, I do things with you, right? I think that that's key. As far as health efficacy, I want you to feel powered, not empowered, but powered to really take ownership of your health journey. And so with doula work, we provide physical, emotional, spiritual support to families. So we are non-medical providers. So that's the difference between us and midwives. I know we get a lot of questions and confusion about that. I don't catch
Mhm.
babies. I mean, I've caught one because baby was falling out, right? And my arm was there, and again, intuition
Right,
just told me, stick your arm out, right? But
right. You had to Randy Moss a baby real quick.
they're real quick, real quick. And so part of that is having you build your birth team. So once you hire me, we're really thinking about what birth experience you want to have. Commonly, people are having to do medical births. So they're going to some type of hospital or clinic for care. If you're trying to do non hospitals, so that would be more private midwifery practices. That's an option too. We
Mhm.
talk about like your family. I love when families show up to meetings, consultations, because if it's your partner, your parents, all those folks are your network of support. So we're really just building up that support. Afterwards, we're diving deep in your preferences. And specifically use the word preference because when you say plan, it's as if birth is planned and
Mm.
manageable. And like that's what Western medicine is about, is managing. And I'm like, we can't manage your birth. We can hope for the best, we can have these preferences, we can do this knowledge, we can do this additional work, but let's talk about, from the time you go into labor, what does that mean? What are your pain management options? What are your comfort measures? What are your options for feeding? What is your postpartum plan looking like? Who's your pediatrician? Who's your OB, right? Like we're really going through all these different layers. I'm explaining the difference between an OB group and a midwife group. And yeah, I think when we think about like outcomes, right? So I talk about with families during consultations, if they're unsure, I'm like, doulas have really good birthing outcomes for families. We lower rates of cesareans, lower rates of pain management. We increase birthing outcomes for parent and baby. We increase feeding rates, specifically if you're trying to do any chest feeding or any type of just breastfeeding, those types of things. We're there for your labor and your delivery. So we're staying with you through that entire process and helping to navigate anything that comes up. And we stay in your postpartum. So as you're recovering, baby's latching, those types of things, we do a lot of this follow up. People don't realize, like, after you have a baby, you're not seeing your doctor for like 6 weeks. Everything is focused on your child.
Mm.
And
Mhm.
between blood pressure and postpartum depression, like doulas catch all of those things because they're asking the questions. We're doing home visits. We're connecting with your families, right? I'm on group chats with families sometimes, and they're like, so and so going in right now, and I'm like, what's happening? What y'all talking about?
Mm.
um, we become family. And I think, particularly as Black doulas, and I use that language specifically because that's where this doula work kind of derived from, is that it's a cultural thing. There's so much to this work that we don't have to. We could just connect as people. So I can ask those hard questions. I can have that conversation. I understand your background, right? I can I can connect with you in a different way than your provider can. You're texting me, you're calling me, you're sharing things. I'm holding you accountable, right? I'm
Right.
reminding you of things that you have to get done. Cause a lot of folks when babies, they're like, I'm pregnant. All right, when's the baby shower? When's the gender reveal, right? Like I
Right. The fun stuff.
ready. Right. Like, and it's supposed to be fun. And I try to
Mhm.
remind people, like, have fun with it. I want them to pray and meditate right to your baby, go to that chiropractor, all these other things that have options for. Connecting to referrals, I think, is a big thing. I think you went dark.
Oh, yeah, I forgot to let me pause it real.
So, we're preparing families for the big day and afterwards. That's really our goal, is to make sure that they feel like they're aware of all of the things that they have available to them and being able to be resourceful and use them, because it's just a lot. It's, a lot of people don't know what to expect with birth. They may have attended someone's birth, or they may have, watched videos, but like, what is your birth going to be like? And there's just a lot of unsurety and fear. Some people don't even know about the Black maternal mortality, but they're experiencing something from their provider that makes them feel unheard. They don't know what questions to ask. So we're really just working through that. And depend on the program or the doula, you have your doula 6 weeks to 12 weeks postpartum.
Right. Can we it sounds, for one, it sounds like to me being a doula is a lot of work. Like, just the I can only imagine, I'm sure you will know more than I do, but the mental exhaustion of having to you're taking the mental state of your patient, like you're almost giving birth with them without the baby.
Hmm.
Like, you're going through that experience with the family and having to be that voice for the mother, be the voice for the family maybe at times, and having to, I'm sure there are times where they're telling you things that they refuse to tell their provider, or they don't know how to tell their provider, or they're afraid to tell their provider, and you're having to deal with all of that. What is that like mentally for you to go through from, hey Jazzmine, I'm pregnant, to baby?
Yeah, for me as a doula.
Yes.
Yeah, I mean, oh my goodness. I think if you talk to me my first year, I'm like, yo, I got to manage these 8 people every 6 months, and Lord forbid I get more, cuz I think what people don't realize, and I can't speak for every doula, but we're not afforded the ability to just quit our jobs. So we're managing life,
Mm-hmm.
full-time jobs, and being a full-time doula. There's no such thing as a part-time doula. That I just can't even wrap my head around that. And so we're connecting with our families weekly, the random phone calls because of a emergency or a concern that showed up on their test results, right? Like, we're taking in a lot. And so it does feel like a lot. It feels like a weight. And I think I make sure that I don't take in everyone's experiences. Like you said, take on, I don't take it in. I don't absorb it, because
Right.
that would be a lot to handle on top of my life, right? Um,
Right.
and so I acknowledge that this is where they're at. I ask them, how are they feeling about this news? What do they think their next steps are? And that's what that power comes from, is like I see myself as a sounding board. I'm not meant to call on their behalf unless something is really happening. That's rare that I've ever had to do that. We brainstorm what next steps are. And so there feels like a release oftentimes after a call, but sometimes like there is no release, that there really is, something going on, and we're having to navigate this oftentimes. And for my clients, and I say that this is complicated, right? Because
Right.
every doula has a certain type of client that is attracted to them. So for me, I have a lot of high risk clients, navigating mental health. Sometimes they're much older. And so we're talking about like navigating the awful words of geriatric pregnancy. So, like,
Mm.
having to navigate those things. I have a lot of folks that are larger in size. And so they're having to navigate conversations around nutrition and diabetes, right? Like all gestational diabetes. And so I do have to manage a lot of different complicated scenarios. But I think part of that work is me taking care of me. And I think that's what was instilled in me during my doula training, was how do I take care of me? And so I actively get massages, I meditate, I do yoga. I have a network of support of doulas that I rely on. I have a network of friends and family I rely on. I really try and practice self-preservation. I don't like self-care. Self-care is expensive. Um,
Mm.
because that means I gotta catch trips and flights, and right, like if I really
Right.
self-care, I'm like, that don't mean I'm here, right? But
Right.
like self-preservation, like how do I manage my schedule? How do I say no? How do I, like you said, wake up in the morning and know my why? Like all of those things are preserving me.
Right.
Make sure that that's there. And so it's fulfilling work. It has a high burnout rate. I think 4 to 5 years, I believe, was the last research that I saw. But it's because we oftentimes lack community. So needing a backup, needing people that are a resource for you in your proximity of your home, life changing circumstances, right, to financial instability. So this is a business. We try and make sure that folks understand you can make money and feed your family and provide for your family through this work. And how do you make sure that that's a possibility? Like, we have tools and things like that we have to buy throughout the year, but commonly this can be income for you. And so how do you make sure to get that? And I think that's what's beautiful about community doula work, because it just repurposes funding in communities of need. So you're not only, investing in work for the family, but you're investing in work for the doula, who then also invests work for other people in their community. So it's really buying Black back, right, in a way.
Mhm.
But yeah, I think you keep things into perspective. There are hard births. I mean, I've cried over births. Births have sat with me. I've had a few hard ones that was like, should I still even be doing this? I could have did this different, right? But you really try not to let it rock you as much.
Right. Yeah. I'm sure they're the they're the good days, and they're the days where everything's just raining down on you, and there's only so much you can take.
Mhm.
You brought up two different things that stood out to me, where that I would like to kind of talk about a little bit further, is the mortality rates and kind of what those are, but also the with the mortality rates, and this being kind of a income source for those who want to do this service.
Mhm.
That kind of shows the benefit of why this should be something that is maybe billable, or something that you can do that through insurance. Can you, it's kind of a long big question, so I apologize, but one, can you talk more about those mortality rates, and like what those are and what that looks like, and the benefits that doulas bring to decreasing the
Mhm.
loss of children, and
Right.
where are we at with this being something that is billable?
Right, Zach. Yeah, that's a great question. So I'll put my research hat on here. I think about just the genesis of healthcare in our country. If you really think about what was happening when this country was founded, right? Air quotes. Pretty much, particularly with Black bodies, it was meant for it to be a commodity. It's a source for income for plantation owners, right? So having the Black woman have more children, and then creating policies and laws that would say her children would also then be enslaved. Like this was the intent and purpose, right? This is where it started. That was never a positive experience. And with the doctors experimenting on Black women without any anesthesia, even though anesthesia existed, from these providers, medical models of care, really thinking about Black folks not having higher levels of pain, thinking about social determinants of health. So, like the risk itself of being Black in this country, and the environment, from transportation to housing to education, all those things are layers and layers on top of things. So, I always talk about that being present when something starts, right? We think about the Big Bang Theory, whether you believe it or not, something explodes, happens, these planets exist. The same thing happens with Black maternal care. It exploded and created a bodies Black bodies are for commodity. So anything other than that would justify it. So when Black midwives were on plantations providing these levels of care for families, from helping people give birth to providing reproductive health, all of that continued through the 50s and 60s, right? And depending on where you're looking at in this country, you see a dwindling of Black midwives existing, because the next reality that happened was, well, they're not good enough to do this. So we see Western medicine coming into another layer of evolution and saying, you all are dirty, your education, your level of knowledge isn't good enough. You see a delegitimized method of removing Black midwives who were providing care to poor rural communities and Black communities, brown communities alike, and a lot of these areas across the country. So when you see them delegitimizing their knowledge, now we have Western medicine trying to manage. So you can look at history. Maternal care is always about experimenting. Oh, well, one moment gas is good, and now we're realizing that it's creating this in children later on, so let's stop doing it. Or let's introduce formula because this is happening, but now we're seeing this happen, so let's stop doing it, right? It's always like this management It's never about centering how the body works. And so with Black maternal care, we see across the country, Black women are 3 to 4 times likely to die of childbirth compared to their white counterparts. If you break that down into each state, right, like Iowa, I believe it's 8 to 10 times. In other states, it's 13, right? So, and people see that number and they're like, well, what does that mean? Like, how does that work? Like, why are they dying at higher rates? A, it's because of our history. B, it's because of our medical model, right? We are not looking at the person. You are deemed high risk just because of your Black skin. So, like, right when you check off the form that you're Black, you're already a high risk. So, we see low iron rates, we see premature births, we see fetal infant death, we see high rates of postpartum depression because no one's checking us. No one's checking in, no one's checking us, no one's really having conversations with us. We're having to navigate um, people not taking additional care and hearing our concerns. I also tell folks like the higher income and education level you have as a Black woman, you see even higher rates of maternal death. Because we're talking back, right? We're saying this is not what I want to happen. And it becomes a very contentious relationship at times. And again, I don't center the fact that like Black people need to do this in order to navigate healthcare. It's healthcare needs to stop being biased. Healthcare needs to own their stuff. Healthcare needs to take accountability for the infrastructures that they have, for the ways in which someone comes in, says I'm pregnant, gets these tests at the time that baby is here and getting this additional care. We don't have strong policies around things like maternal leave in this country. We also see just the impacts I mentioned, social determinants of health, these health disparities that already commonly exist. These hospitals are not handling those things and they structurally can't, right? So then you're seeing all these community organizations having to invest and figure these things out. But really, we're putting band-aids on things. We're trying to catch up. And I think there's a lot of goodwill and people really trying to do the work. I really think about there needing to be a 360 model. So with communal doula support and having there be a strong relationship with providers and then additional service providers in the community, us building a network of support to cocoon this parent is it shows strong birth outcomes. It shows positive outcomes. Because I also tell people, talk to your parent about their birthing experience. 9 times out of 10, they're going to tell you that they had a very poor one, they had a decent one, it was okay. But I always get families saying, yeah, this happened to me. And then as you start to dive into it, they're like, yeah, this allowed me to connect with my baby. That was a conversation I had with my mother. Not really realized my mom had postpartum depression as a Black woman in Chicago. And then also having to navigate, being a new citizen, right? All those things she had
Mhm.
to navigate, and no one asked, and that really impacted her ability to bond with me and be with me in ways that would have really impacted my development, my sense of self, right? I'm 34 and we still talk about this, right? She's in her late 50s. So we see just a cycle happen. So you have a negative birth experience and then your child ends up growing in these areas, and then they, if no intervention is provided, have a negative birth experience, and we're just seeing generational trauma just being passed off.
Mm.
So it has to end somewhere. And even with Black infant mortality, we're seeing there was research done in California that says Black infants are more likely to survive if their pediatrician is Black. The question is why? Like, why does race matter so much? It's not race, it's culture. I think people get those two things confused. We're not trying to build a race war out here. Like, if anything, Black people were really trying to be like, could we just not? Like, I think we're just like, like, we've been trying not to for like generations, and like, y'all
Right. Can we
ain't
chill a little bit?
like just a little bit, please and thank you. Um, but it's culture that we speak our language. We know why we eat collard greens, right? And so medical models have to get on the train of not just looking at medical culture in this white centered way. When you think about food and access and support, like, we're not all out here doing this one thing and you're an anomaly if you don't. Like, everything has to be individualized. It has to be taken into this case, this situation, this person, this body, this mom, this baby, this family, right? Like, this particular thing. When you start to try and place this one type of thing on all families, you're going to see a big issue. And I think doulas create that agitation, right? When I talked about agitation, doulas, us even being in the space, I've seen a difference in the way doctors treat families because they know that they have a doula. If anything, I hope that it is not a fear mongering thing for providers, but I think it creates more accountability for a family to say, I have a doula. And you're like, oh, you see them just kind of, okay, let me walk you through all of this, right?
Mm,
But
mhm.
it shouldn't be about that. It should be about, I'm doing work for people. I took an oath. I tell doctors, I'm like, you took an oath. It says that you are here to serve people. When you start to build in your bias and not unravel it, this is where you miss things. You misinterpret things. You don't take extra care. You don't take extra steps, right? And then your attitude comes in. And then I'll be honest, I understand hospitals are overburdened. A lot of these providers are carrying a lot of weight with these healthcare deserts. Like, I totally get it. And also, there needs to be more investment in the community. Then we shouldn't be, closing clinics. We shouldn't be closing birthing centers. Like, that's not what we're doing. The reverse. We're going back in time when we are doing these things. And then on top of that, reproductive justice, right? Who do these things impact the most? The folks at the very bottom, right? Folks that already don't have the access and the resources. And now you're limiting scope and practice. That impacts us because we are the last to be served and we're the last to be cared for.
Right. Whew. Yeah, that's so that's a whole lot, but I think you're doing great work. Where do you see the role of the doula in the future when you envision that? And I know when we've had conversations, when we had that conversation, you talked a little bit about the future of doulas. Can you tell me a little bit more about that? Where do you see this profession going?
Yeah, I and a couple of things come to mind. So I'm in the Morehouse perinatal health navigator program. So it's primarily used for folks in the Atlanta area, but I was afforded an opportunity to join the program, and so we're learning how to be more embedded in the hospitals. Not in a way that we are beholden to the policies and the practices of the hospitals, but really learning a little bit more about how to be alongside the family. So not just looking at it from a scope of just, birth, but how do we help folks in managing diabetes to anything that is an additional layer to their healthcare? And how are they navigating their pharmacy experience and their medication, right? Like, being able to ask these questions a little bit more in depth, because as doulas, we're really, depending on the training, you're really just looking at the process and experience of birth, but there's so much outside of that we talk through that we need to know more about. I think that is a really good model of practice. I think we see that with a lot of the organizations in the South and then in Southern California, with being a little bit more of this 360 model of care. I think we need to move towards Medicare covering our support, right? I didn't get to it a little bit, but the fact that, doulas are having to do this work, we should be compensated. You mentioned this is a lot of work. Yeah. And there's really no amount of money on the planet to make this feel better or to make this care for ourselves in a better way, but to be compensated adequately for the care that we provide our families is really important, and it saves money. That's a big thing. Is doulas save money. It saves federal and state dollars. And I wish people understood that. If you're talking about dollars and cents here, guess what? This gonna keep money in your pocket. Let's do it. This also, like, keeping doula work at the community level. You see a lot of programs being built that don't have community doulas involved, that don't have that community level practice, and they start certifying and deciding on what level of education, what type of doula training, right? When you start to build on those types of barriers, those are barriers, right? Like those are
Right.
barriers to our practice, barriers to being able to provide care. And this just goes right back to delegitimizing of our knowledge. So they talk about things being Black centered and Black led when it comes to Black maternal mortality. And I always put a little dab in there, a little spice of we need more direct entry midwifery practices. Like this nurse midwifery thing, I get it. It's cool. It makes sense for a lot of people. We need more midwifery groups, but it's just not affordable for people to go private for their care if they so choose not to go to the hospital. We're looking at five to $10,000-$12,000 to get a
Yeesh.
private midwife because direct entry midwives are not supported in the hospital. So we're really, really trying to do the work supporting the direct entry programs, so that community people can have access. Because if I didn't go to nursing school or don't have a BA, I can't be a midwife. And that does not help me, my community. We see the same white faces across the board, and it doesn't resolve the issues that we need to have of having diversity, right? To really
Right.
shift the needle. But those are the big things that I can think about.
No, that's good. Thank you for that. Jazzmine, thank you so much for
Yeah.
being on the podcast with me today. I truly appreciated your time. For those that are interested in learning more about you, 'cause I know you got some, I saw the new website and stuff that you got going on. You got some stuff popping right now. If anybody wants to just connect with you and learn more about you and what you're doing, where can they find you?
Yeah. So please connect with me on Rural Black Doula, all social media platforms, TikTok to Twitter, Instagram, Facebook. ruralblackdoula.co. We're having upcoming community spaces. I'm really wanting to dive deeper into movement and healing. Like we said, life is life in, and I want our people to be well. And so, going to be doing some yoga classes for the community coming up in February. If you're interested in a doula, you identify as African American in Iowa, we do have a doula project that you can connect with. You get a doula for a no cost. And there's doulas within 4 counties. So Polk, Blackhawk, Scott, and Dubuque. So if you live in any of those areas or within any of those areas of the county lines, like please reach out and connect with a doula. There's no wait time. Like you can connect with one right away, and the earlier the better. But if you're needing one now, like again, this is a great opportunity to move forward with doula work. But yeah, just hit me up. I'm here to answer questions. If your organization, would like a presentation to building, centered support services, like I'm here for all of it. So thank you.
Awesome. Awesome. Again, Jazzmine, thank you so much for your time. And everyone, thank you for listening to the Healthy Project podcast. I'll holler at you next time.